Today and welcome for a new presentations in Ease and Different Radiology. I am Dr. Osama Ibrahim and today our appointment number 3 in cranial nerve examinations and the presentation. I started this set by first presentations and lectures about cranial nerve anatomy, and I talked about in the previous lectures for the anatomy of 12 cranial nerves. The next presentation I talked about the optic nerve as a cranial nerve 2, and today presentations I talk about the cranial nerve 3, 4, and 6. So let's start our presentation. The learning objective from my presentation today, I talk about the cavernous sinus contents, which contain these 3 cranial nerves plus cranial nerve 5, which I will talk about it in the next presentation. Superior orbital fissures, which is one from pathway of these cranial nerves, and I will talk about some pathologies of these cranial nerves. The target audience, as I talked before, is for clinical radiologists, for audience who prepared for examinations like FRCR2A or 2B, as well as there and other boards like Arab board and other boards. Neurologists also one from my target audience in this presentation. Let us talk about the cavernous sinus anatomy. The cavernous sinus anatomy is this area which is superior to the sphenoid sinus, and the cavernous sinus is mainly composed from cavernous venous plexuses and carotid artery, internal carotid artery. The cranial nerves arranged in the lateral wall of the cavernous sinus are arranged as oculomotor nerve, cranial nerve 3, then cranial nerve 4, trochlear nerve, and then two divisions in the lateral wall of cranial nerve 5. The first division is the ophthalmic division and second division is the maxillary division. After that, cranial nerve 6 is located internally in the cavernous sinus. We can remember this by mnemonic word O tomcat, O refer to the oculomotor nerve, T refer to trochlear nerve, O ophthalmic branch of the trigeminal nerve, and M from maxillary branch of the trigeminal nerve. CAT can be arranged transversely like this: carotid artery, internal carotid artery, A from abducent and T from the trochlear nerve again. So you can remember it by this O tom in the vertical and the CAT in the horizontal orientations of the cranial nerve within the cavernous sinus. Most cranial nerves, as I mentioned before, are arising from the brainstem, except the first and second, olfactory nerve and optic nerve. The others are arising from the brainstem. Like this diagram, which is showing the olfactory and optic arising directly from cerebrum. However, 3 and 4 arising from midbrain. Then 5, 6, 7, 8 arising from bones, and the last four cranial nerves arising from medulla oblongata. So today I will talk about the cranial nerve arising from midbrain, oculomotor 3 and 4 trochlear, as well as I will talk about the abducent also, which arising from the bones. The first cranial nerve today is the cranial nerve 3, which is a oculomotor nerve. As we see here, this is the midbrain, which looks like Mickey Mouse ear. The midbrain arising two cranial nerves arising from this midbrain. One from them is the oculomotor nerve. Oculomotor nerve is directed anteriorly toward the superior orbital fissures to supplying most of the extraocular muscle, as I will mention later. Here, MRI examinations, which you can see cranial nerve arises from the midbrain in both sides of the interpeduncular cistern, and this is the basilar artery in the middle, and this is the course of the oculomotor nerve as the intercisternal part. in that CSF, surrounded by CSF, until reaching to the superior orbital fissures, entering to the extraocular muscle, supplying them except lateral and superior oblique. The oculomotor nerve is going towards the superior orbital fissure, as I mentioned, and then splitting into two branches. One superior branch, which is supplying the superior rectus muscle and the levator palpabri superior muscles for the eyelid. The inferior branch is supplying the other remaining rectus muscle, inferior, medial, and inferior oblique muscle also. It can also send a branch for ciliary body. This MRI images again showing the midbrain, and this is peduncular cistern, interpeduncular cistern, and this is cerebral peduncle, the cranial nerve arising in both sides of the basilar artery. And in the coronal view, you can see this is the basilar artery, and this is the posterior cerebral artery, and this is the superior cerebellar artery. The oculomotor nerve, cranial nerve 3, is located in between these two arteries, superior cerebellar and posterior cerebral artery, as a terminal branches of the posterior circulation. So this part is the oculomotor nerve. The next nerve is the nerve number 4, or cranial nerve number 4, is written by Latinic word like this, and it is called the auricular nerve. The auricular nerve, it is the only cranial nerve which arising dorsally from the brainstem. Most of the cranial nerve is directly and going anterior like this. This one going anterior also, but takes this pathway dorsally, then going to ambient cistern, and then go to the superior orbital fissure, also to supplying one specific muscle, which is the superior oblique muscle. As we see here, this MRI, we can see the midbrain, and that is the trochlear nerve, which is taking this pathway through the ambient cistern, then going anterior. So it is considered the longest cranial nerves, which have a longest course intracranially. This diagram also showing that nerve which is supplying the superior oblique muscle. This nerve is trochlear nerve, supplying the superior oblique muscle and responsible for its movement and arising from the midbrain, but taking this pathway posteriorly through the ambient cistern, and then to the superior orbital fissure and supplying the superior oblique muscle. Cranial nerve 4, as I mentioned, this is the longest intracranial course at about 7.5 centimeter. However, it is the thinnest cranial nerve, have smallest thickness of all examined cranial nerves. So due to this thin thickness, it could be not recognized clearly in MRI. However, here in this image, you can see the cranial nerve taking its pathway and supplying this muscle, specific muscle, which is called superior oblique muscle, located here in the orbit between the superior rectus muscle and the medial rectus muscle. And that one is the optic nerve. This is the inferior rectus muscle, and this is lateral rectus muscle. However, the upward gaze is supplied is the responsibility of this muscle, superior oblique muscles, which is supplied by the auricular nerve. So if there are any paralysis of this nerve due to any cause, tumors, ischemia, or compressions by adjacent structure, it causes extrotorsions, outward rotations is affecting. The extorsions is due to the negative muscle contractions of the inferior oblique muscle. Patient complains from diplopia and other manifestations of downward gaze and so on. This again the midbrain. So the midbrain, two cranial nerves are arising from it. Is the oculomotor nerve, cranial nerve 3, and trochlear nerve, cranial nerve 4. So if we want to search for trochlear nerve, search posterior dorsally like this, which passing through the ambient system. And again, this one is a superior cerebellar artery. So this superior cerebellar artery passing posteriorly, over that one passing anteriorly through the ambient system through the superior towards the superior orbital fissure. So this one is the trochlear nerve or the cranial nerve number 4. And this image again showing that nerve which passing between the posterior cerebral artery, the end branches of the basilar artery, and superior cerebellar artery. If you find nerve here, this nerve could be cranial nerve 3 or cranial nerve 4. So here, for example, is the superior cerebellar artery, and this one is the trochlear nerve, and here also this one is the trochlear nerve, and oculomotor nerve 3 and 4 passing between that course between the posterior cerebral artery and superior cerebellar artery. Trochlear nerve neuropathy, it could be simple, specific for it itself, and could be complex with the other cranial nerve injury due to brainstem stroke or tumors and or any pathology in the brain. And now with cranial nerve 6 is called abducent nerve and arising from the bone. So if you find the bones like this is the bone. So the cranial nerve which arising from it and directed anteriorly is the abducent nerve. There are another one also directed anteriorly, which is trigeminal nerve. I will talk it separately about it in the next presentation. So the cranial nerve which passing anterior from the bones and have thin thickness like this, so it could considered as a abducent nerve, and this nerve is motor. And this diagram showing the abducent nerve which is supplying the lateral rectus muscle. So this is the lateral rectus muscle, and that nerve rising from the bones and going directly toward the lateral rectus muscle to supply it from through the superior orbital fissure also. So during its course, it passing between the posterior aspect of the clinoid and the petrous, and this called is the Dorello canal. Dorello canal is one from landmark of passage of this cranial nerve, abducent nerve, cranial nerve 6. So if there are any pathology in the petrous or in the clivus or in that clinoid process, like tumors or other lesions, it could be causing compression of that nerve and causing pathology for the nerve and manifestations of the muscle supply, which is the lateral rectus muscle. So again, this is the pathway of the cranial nerve 6, which passing directly to supplying the lateral rectus muscle and passing through this canal between the clinoid process and the petrous bone. The cranial nerve 6 is passing anteriorly, and this artery is the anterior inferior cerebellar artery. It could be seen by arising from the basilar artery, and can be seen at that levels because it is level of the bone. So this is the anterior inferior cerebellar artery, could be considered as a landmark for that nerve which arising from the bone. Important to note of about the abducent nerve, it arising from this area, and this area could be, if any pathology in the clivus bone and the petrous apex, it could be affecting that nerve supply and causing its affections and impaction on its muscles, which is the lateral rectus muscle, so the eye is not abducted. So my presentation is finished, but I want to finish it by some quizzes, a little bit quizzes, about 3 quizzes only to support my word through the presentation. This 82-year-old woman with ptosis of the right eye. which cranial nerve affected here? If you look, this is the midbrain. So this is the first question you ask yourself about it. So midbrain, the second question, which cranial nerve arises from it is the oculomotor nerve, and the answer is oculomotor nerve and trochlear nerve. So this one is the oculomotor nerve, and that one is the oculomotor nerve in the other side, which appear normal. And there are some pathology here or some deviations of the basilar artery compressing the arising portion of the right oculomotor nerve. So patient complain from right eye ptosis because the oculomotor nerve supplying the superior levator palpebral muscles which supplying the eyelid. So this is the cause of the ptosis. You can discriminate this through imaging of the cranial nerves. So pathology here in the cranial nerve 3 oculomotor nerve of thalamoplegia. Which cranial nerve is this one? This case from my daily work cases. So what is the questions you ask yourself to answer this? First, you should discriminate which part from the brainstem this one. This one is the bones. So you know that bones arising nerves, two nerves directed anterior from it, the nerve 5 and the nerve 6. If the nerve is thin like this and there are no Meckel's cave, so you consider it is a nerve 6. So this is the abducent nerve. By this way, you can answer your questions. From the cat, carotid, abducent, and trochlear. And again, you can remember the structures which passing through the superior orbital fissure from this word, lazy French tarsus, set naked in anticipations, L from lacrimal nerve, branch from cranial nerve 5, and F from frontal nerve, branch from cranial nerve 5, also ophthalmic branch, and cranial nerve 5, trigeminal ophthalmic branches in cranial nerve 6 trochlears, T from trochlears, and S from superior division of the cranial nerve 3. As we mentioned, they have superior and inferior division, both of them passing through the superior orbital fissure. N refer to the nasociliary nerve, branch from the cranial nerve ophthalmic branch again of the trigeminal nerve, and I in inferior division of the oculomotor nerve, and A from the abducent nerve. So this is lazy French tart set naked in anticipations. You can remember the arrangement of the structures or cranial nerves passing through the superior orbital fissure. And last summary is the extraocular muscles. Extraocular muscles, this case from my daily work cases also. This case has another pathology here in the maxillary sinus antrum. However, this is only to remember the extraocular muscle. Extraocular muscles, that one is the superior oblique muscle supplied by cranial nerve number 4, which arising from midbrain. And that one is the lateral rectus muscle supplied by cranial nerve number 6, which is abducent nerve arising from the bones. However, the remaining muscles, extraocular muscles, superior oblique, medial oblique, inferior oblique, this is inferior oblique, sorry, superior rectus, inferior rectus, medial rectus, and inferior oblique are supplied by the oculomotor nerve plus the superior palpebral muscle. So remember these two muscles, superior oblique, which is supplied by 4, lateral rectus, which is supplied by 6, and the remaining are supplied by the oculomotor nerve. At the end of my presentation, I hope I provide you with clear knowledge about the cranial nerves 3, 4, and 6, which passing through cavernous sinus and superior orbital fissure. Remember my presentations which talking about cranial nerve every Friday, and I talked also in the other canal easy and different radiology too by Arabic for the chest, and follow me in both channels, easy and different radiology and easy and different radiology too. And also you can watch more than 160 videos in the is and different radiology channels by English. Thank you very much and good night.